Question 22a asks students to discuss the impact of emerging new treatments and technologies on healthcare in Australia, and this was worth 5 marks. We have a look at our syllabus. Under the dot point of healthcare in Australia, we see impact of emerging new treatments and technologies on healthcare, example cost and access, benefits of early detection. So they're the things that we would like to have had in the answer that I'll be looking for. The key part for this one is that it talks about discuss the impact, and for discuss, students must identify the issue and provide points for and against. So you need to be looking at both sides of the coin here. We're going to have a look at our example. And I'll tell you what I like about this example, and this student was able to do this through the whole exam that he had, is his highlighting and his use of examples. It really is a credit to him the way he sets it out. Got some things written up here. Boys did that, which was excellent. But again, discuss the impact of emerging new treatments and technologies on healthcare in Australia, looking at cost, access, benefits of early detection, and the points for and against. This was worth 5. So we're looking here at the first one. Emerging new treatments and technologies have both positive and negative impacts on healthcare. There's providing points for and against. The cost is a negative impact of emerging new treatments as it places financial burden on the healthcare system in Australia. In effect, placing more burden on society, individuals, in regards also to taxes, also cost of treatments not covered by Medicare. That's for the example. And if a new treatment becomes available, it may place costs to an individual seeking to use this treatment. So there's some points against it. Potential for early intervention and prevention. Within the rise of their new technologies and treatments, there becomes a greater opportunity to intervene in disease in the early stages. There's our intervention. Also, prevention can take place. For an example, the example here being breast cancer screening is a technology that promotes both prevention and early intervention. Then we move on to access. With emerging new treatments and technology, has a positive impact on the accessibility of healthcare, treatments and technology. This is because there are more options for preventive and early intervention and treatment. So the example being the introduction of cancer screening and making it a lot easier for people to access this. Therefore, that leads and ties in with our prevention and early intervention. So that's why this is a really good answer. And again, if we can all learn something from this response, it's the way in which it's a bit of highlighting and the example here. So highlighting of both the example and the key term, which is really the important part. Again, showing both sides, the points for and against. Some other things could talk about the emerging new treatments, less invasive procedures, more preventative focus, which we sort of spoke about here. Less cost to the individual, but a bigger cost to the community. Greater chance of recovery with these newer technologies. People going in and out one-day surgery. Greater ageing population and associated costs. Talks about Medicare and the pharmaceutical benefit scheme, the burden it places on them. More expensive medical cost to the community because there are more technologies being implemented, and a greater cost of medical research, which also always comes back to the allocation of funding from the government. But that's the reason why this was a 5 out of 5 overall. A very good answer. Had at least 3 things in there which come from the syllabus, which are included with some examples to support it and showing, the points for and against it.